Hi, welcome back to Rohrich Knows Podcast, helping you become a better you and a more informed you. I'm Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Today, let's talk about CBD, doing the CBD. What are the top 5 things you need to know? So let's define it. What is it? Is it safe? What are the benefits? How do you use it? And what are the pros and cons of CBD? And first of all, what is CBD? You know, CBD is cannabidiol, which is a non-psychoactive compound found in cannabis plants, marijuana plants. Unlike THC, which is delta-9 tetrahydrocannabinol, the CBD does not produce a high, and it's legal in most places, including Texas, especially if it's less than 0.3% THC. And I think the beauty of it is it has a lot of powerful, individualized indications and uses. So let's talk about CBD. So this is the delta-9 tetrahydrocannabinol, their marijuana leaf, but this is the CBD cannabidiol formula. It is completely different. It is a very powerful compound. So let's break up the stigma and find out what really is CBD, and is it safe? The answer in short is there's a lot of scientific studies that summarize it, and you really have to advance your education of cannabinoid education and to understand it. And the studies have shown that the overall pain reduction with CBD, pure CBD, like is seen in this company data from Corganics, which is a very excellent, it's an excellent company that does pure CBD. The overall pain reduction is 64%. I use it a lot in my patients with elective cosmetic surgery, sleep improvement, and overall anxiety reduction. Significant relief of all of these areas. And the key with all of these CBDs is that they have to be third-party tested, so they have no THC. Did you know that up to 50 to 60% of CBD that's marketed in stores has THC in it, and that's a real problem. That's why I like to make sure I have a medically pure one, like Corganics has one, that really allows me to give it to my patient with the trust that it's pure CBD and no delta-9 tetrahydrocannabinol. So what is it? Is it safe? And what are the benefits? The benefits, as I mentioned briefly, is there really are 5. It's pain relief, anxiety and depression, and sleeping disorders. It helps with all of those. And the great thing about using this in the perioperative areas, this helps everybody. Everybody has some discomfort, they have some anxiety, and then they have sometimes trouble sleeping. So adding a CBD, whether it's a tablet or even a sublingual dose, really helps to calm the waters. And it's also, number 4, it's neuroprotective. So it has potential benefits for other things like MS and Parkinson's. So the benefits are tremendous. So how do you use it? That's always comes up, and that's why I like pure CBD product. It can be an oil, a tincture, a capsule. It can be an edible. I like the capsules, and I like the tinctures. And so, you know, it comes in droplets, and it can come in soft gels. And I like the droplets and the soft gels. I use the droplets in the office when I'm doing fillers or Botox. It helps to just calm the patient, and there's really no side effects. And the soft gels, I use it pre-surgery and then post-surgery as well. And I think it's rapidly absorbed, and it works beautifully. So this is my protocol, and you're free to use it. You know, I discontinue all non-steroidal anti-inflammatories 14 days before. I begin the CBD soft gels a few days before surgery, up to 7 days before, once a day. Then after surgery, I begin the soft gel that night, morning and night, and then you can put it on the cream as well to the incision site. But mainly I'd rely on the soft gel and the droplets, especially if I feel like I need a boost during the day, and I'll just have them just take a sublingual droplet, and it works great. And again, like I said, you're welcome to share this with your patients, and it's very, very powerful and very, very safe. So the key is regulation by country, region, by state, and buy from a reputable source. And Corganics is one of them that truly does that, and that's very, very powerful. And look for third-party tested products. That's so important. So the last thing is, what are the pros, what are the cons? Well, the cons are the side effects. Infrequently you have dry mouth. Occasionally you can have a decreased appetite, drowsiness, and fatigue, but very uncommon. And occasional diarrhea, although I've never seen that. It can interact with blood thinners, so obviously you're going to stop blood thinners before surgery. And then the regulatory concerns. You know, obviously you have to make sure you have a pure quality product and it's safe in your area. And the pros is that it's a non-psychoactive, there's no high effect. It's got incredible pain, anxiety reduction, relief, and improved sleep. It's very versatile, and it's just phenomenal. So, you know, the key thing is, you know before you go, and make sure you find a product that's pure, third-party tested, and is pure CBD. And I think that you cannot go wrong with that. So those are the 5 things. It's safe. It's very, very powerful and beneficial as an adjunct to minimize the need for any narcotics after your surgery. And it's very, very powerful, and it allows you to use it in almost all of your patients. I use it in all of my cosmetic patients, especially my rhinoplasties and facelifts. So hopefully this has been very helpful in answering to some of the common questions about CBDs. Know before you go, and find one that's pure, that's third-party tested. So give me your thoughts, give me your comments, and helping you become a better and more informed you. Till next time.